Hello and good afternoon, everyone. This presentation will focus on the rural, faith based outer island communities in the Tongan Nation. This health intervention will focus on reducing the burden of heart disease, type 2 diabetes, and obesity through strategies that are culturally competent. This will be accomplished by um, forging partnerships with churches, establishing mobile outreach divisions, and conducting nutritional education classes. The goal of this project is to introduce a health program that integrates the cultural values and societal norms of this Tongan community with the intent of increasing the likelihood that the interventions will be accepted by the people and eventually successful. The rural outer island communities in Tonga are not only geographically isolated, but it has adopted a collectivist societal structure that is greatly influenced by religious leadership. This population has a significant burden of non communicable diseases, specifically obesity, heart disease, and diabetes. Contrary to its urban counterparts, people in these communities rely on a family network to make decisions. The church plays a significant role not only in the behaviors and beliefs of the people, but also in the healthcare practices. Also, access to healthcare is limited due to the distance and the or infrastructural challenges. So, prevention and early detection, as well as intervention, becomes even more important. The specific subculture targeted is the rural island Tongan communities. These groups are isolated geographically and lack access to specialty health services routinely. So their daily lives are centered around church involvement and family networks known as kanja. This group was chosen because their health behaviors are strongly influenced by cultural determinants. Also, mission based partnerships are generally more effective um, when they work through trusted institutions such as churches. Geographic barriers and costs often delay follow ups and screenings, which increase the chronic disease burden that these people face. The rising burden of non-communicable diseases is the primary health issue. Diabetes prevalence continues to increase, and obesity rates are exceeding 70%. These conditions are the major causes of death among the Tongan community. This health crisis is fueled by changes in diet, reduction in physical activity, limited access to health care, and delays in treatment. Current data shows that the adult obesity prevalence is approximately 70.2%. Diabetes prevalence is around 19% and is projected to reach over 22%. These conditions significantly increase the risk for heart disease and place a heavy burden on the healthcare system. This situation is made worse by limited preventive care, the dietary change to processed foods, and delays in treatment. Large body size is associated with strength, beauty, and prosperity. The social practice of eating together is a deeply rooted custom which makes changing one's diet difficult. Religious beliefs have a strong influence on the acceptance of healthcare interventions and daily routines. Healthcare decisions are seldomly made in a vacuum. Most times, family members and community leaders are involved in any healthcare decisions made. Geographic isolation makes travel between islands difficult, which will delay screenings and follow up care. So, aiding in health literacy is another challenge, especially for chronic diseases that are asymptomatic at first. The limited healthcare workforce negatively impacts the continuity of care. And economically speaking, processed foods are often cheaper and more accessible than healthier food options. Cultural biases um, affect both providers and patients. Providers may misinterpret respectful silence as a patient being non-compliant, while patients may view providers and healthcare systems as impersonal. The widening communication gap arises because patients typically avoid questioning those people who are deemed authority figures. This misinterpretation can lead to poor adherence and fewer people making or seeking healthcare. The program goals and objectives. Well, the goal is to reduce obesity, heart disease, and diabetic risk over the next 3 years. We look to achieve this by improving education, supporting healthier eating habits, and increasing screening rates. Following the SMART framework, the set goals are to increase screening rates by 35%, boost participation um, in learning sessions by 40%, and improve diet quality in approximately 50% or more of the families enrolled. These are measurable goals that are allowed or that will allow for further evaluation. Partnering with pastors and leaders, we can deliver health education in a familiar and comfortable environment. Conducting weekly or bi weekly sessions will, and while also employing simple language and teach back methods, will help facilitate learning. The message will focus on family strength and prevention. This approach will bring together health behaviors with spiritual values. When it comes to the nutritional program, we're going to focus on promoting traditional foods such as taro, fish, cassava, which are healthier options than the processed foods many consume. We will conduct cooking demonstrations that will teach practical skills, including reductions in salt and sugar. And this will help families make better food choices and while reinforcing cultural identity and improving health. When it comes to the mobile clinics, we're going to provide monthly outreach to the rural communities. Um, some of the services that will be provided will include blood pressure monitoring, blood glucose monitoring, BMI screenings, as well as follow up care. This approach will address the geographical barriers and ensure continuity of care for the patients. As it pertains to the timeline, the first couple of months will be focused on partnering with local leadership, churches, clergymen, and planning. Once we reach mid year, we will begin to um, incorporate educational events and screenings, followed by evaluation and sustainability planning. The budget of $10,000 will be stretched across different areas, more specifically, educational materials, training of the staff, transportational needs, and clinic supplies. Uh, with regards to the outcome evaluation, the success of the program will be measured through participation rates, BMI trends, blood glucose levels, and screening numbers. These indicators align with program objectives and gives way for continuous improvement. In conclusion, integrating healthcare into the existing social and religious structures through a culturally competent approach will offer the greatest success and long-term sustainability of the program, while also addressing the health challenges of the Tongan Nation. It's only through culturally based care, forging strong partnerships, and long term engagement will success be met. Thank you very much.